Hello, my name is Brianna, and today I'm going to be explaining my microbiology disease presentation. The infectious disease that I chose was pertussis, otherwise known as the whooping cough. The signs and symptoms include coughing, sneezing, runny nose, and are usually diagnosed when coughing persists more than 1 to 2 weeks. Children diagnosed with the whooping cough may have trouble catching their breath, and they may also experience vomit, spit up, and/or fatigue. Infants with this may have breathing problems and eventually develop pneumonia, seizures, and possible brain damage. The pathogen and virulence factors of pertussis would include the production of many virulence factors, including pertussis toxin, sialase toxin, filamentous hemagglutinin, fimbriae, tracheal cytotoxin, and pertussin, as well as demanocrotic toxin. Pertussis is mainly a toxin-medicated disease. With pertussis, the bacteria attaches to the cilia of respiratory epithelial cells, produces toxins which paralyzes the cilia, causing inflammation in the respiratory tract. This then, in turn, interferes with clearing the pulmonary secretions. Some recent studies suggest that bacteria are present in alveolar macrophages when this disease is present. For the epidemiology, pertussis occurs worldwide. Pertussis is a human-only disease, which means that no animals are affected. Children and adults are important reservoirs for Bordetella pertussis and are often the cause of an infant's infection. Transmission of this disease occurs by droplet contact or by airborne droplets. Pertussis follows no seasonal pattern, which means it can occur at any time. Pertussis is highly communicable among susceptible household contacts, and pertussis patients are mostly infectious during the first 2 weeks after the onset of their initial cough. Pertussis may be diagnosed by history of signs and symptoms, and also through physical examination, as well as blood tests and mucus samples from the back of the throat through the nose. Pertussis is normally treated through the use of antibiotics such as azithromycin, clarithromycin, and erythromycin. Clinicians may also use trimethoprim sulfamyoxole as a form of treatment. Prevention can also be going on if people were properly covering their mouth from coughing and sneezing, as well as washing their hands when they cough and sneeze. There's also immunizations available to prevent this from occurring. I hope you enjoyed my presentation. Thank you so much.